When we're going through the IVF process and going through an egg retrieval, we then hear a lot of numbers. And could you explain kind of the typical attrition rates that we would see through the IVF process? What are we sort of aiming for? How important are these numbers as well to take into consideration?
That is a really great question. And I love, if you look at like just infertility, the definition of infertility is someone who's less than 35 is attempting pregnancy for 1 year and not achieving a pregnancy. So that is like less than 35. If you're greater than 35, you would shorten that to 6 months. So the reason why that's important is that if greater than 35, like time is of the essence, you need to get busy. But what I love about that number is that if there's 12 ovulations in a year and you haven't been pregnant, then something's going on. Well, what's really unique about an IVF cycle is that's about the average number of oocytes or eggs that we get from a patient. It's around 12.
Cool.
And so I'm going to give you some real numbers, like someone who's less than 35. If you had 12 oocytes, 10 of those fertilize or even let's say 10 are mature, 9 fertilize. Out of those 9, you're going to get probably 4 blastocysts. So you have a lot of attrition between day 1 and day 5. That's from the fertilization to day 5. But that blastocyst is about half of those then are genetically normal. So you might have 5 blastocysts. So out of that, 2 to 3 embryos are genetically normal and able to implant. And so statistically, it takes about 1.6 embryos to have the baby. And so if you think about those 3 embryos, you probably would get, if you had 2 embryos, you're probably going to get 1 baby, maybe 2. If you have 3 normal embryos, you're probably going to get 2 babies out of that. And so you can see the equivalent of a year's worth of ovulations. What did we get? We got 1 baby. And so there is a lot of attrition, and it's not a bad thing. It's just those are the kinds of things that are happening in the body every month. But we get to see it all in basically 1 week. And it's really, really rewarding to kind of see the embryos grow. And, and as somebody becomes less young, let's say 35, maybe there's just not as many eggs and also you have higher rates of abnormalities. So when you get up to the 40-year-old range, that's where it becomes more and more difficult because you need numbers of eggs. You need lots of eggs because there's fewer and fewer normals out of those 3 or 4 embryos.
Right.
And so I like to use it as an analogy of like going to Vegas. The more times you can roll the dice, the more chances you're going to get pregnant. And each egg is a roll of the dice, so to speak.
Right.
And so that's where the attrition is.